Skin cancer is something that touches the lives of millions of people every single year. And here with advice on what to watch out for and preventative measures is board-certified dermatologist and co-host of The Doctors, our friend, Dr. Sonia Batra. Welcome, Dr. Batra. Ali joining us here as well, because obviously this is something that you're very passionate about. But now, Dr. Batra, we'll get into the medical aspect of all this. But Ali, you were recently diagnosed with basal cell carcinoma.
Yes.
So tell us about what happened and the diagnosis.
Absolutely. So it's, which you'll talk about in a minute, but very treatable. It's the type of thing, if you catch it early, you're good. So I'm very, very fortunate. But yeah, I had this spot on my stomach. I had a kind of precancerous spot removed 6 months prior. So my doctor's like, you need to come in every 6 months now. Okay. So I already had an appointment for 2 weeks when I noticed the spot, but I noticed like it almost looked like a scab. It kind of hurt a little bit. It was raised bumps. That's it right there. And then I was like, I don't know what this is. Well, go away. And then the redness and pain went away and it was still there. And I'm like, okay, this is something. And I already had my appointment scheduled, luckily, because I'm very diligent about getting my skin checked. Went back. Found out it was the basal cell carcinoma. I think when the word skin cancer first came out of my dermatologist's mouth, I kind of panicked for a second. Like I was like, wait, what? And he was like, don't worry, this is treatable. Because you came and got your skin checked, we can cut this out. And you're going to be good. And so I've been very fortunate that I do get my skin checked, and now I have a voice where I can spread awareness to encourage other people, because I've been talking to so many people since this happened, and they're like, I've never even thought to get my skin checked.
Right. I mean, it's true. Using something difficult like this, transforming, we've talked about it before, and it's something positive, spreading awareness, so thank goodness you got yourself checked. Basal cell carcinoma is something that affects a lot of people, and Deb, it's kind of like both your mom and my mom.
You're not alone.
Yes.
Over 4 million people every year are diagnosed with this. As a matter of fact, my mom is at the doctor today getting her third one looked at. She's had one removed from her forehead and 2 on her legs, and she is now going back to get a checkup. I mean, there's nothing life-threatening about any of this, so it's just good to get the word out there. And I know your mom has also had it.
She did, yeah. It was scary. Right? She had it on her nose pretty bad. She didn't get it quite as early, so she had to get a skin graft and some things done. But she's doing great as well.
The good news is it's treatable.
Yeah, exactly right.
Yeah, I mean, if you have to have anything with the word carcinoma in it, and I know that can be so scary, a basal cell carcinoma, definitely the best one to have. Completely curable in someone with a normal immune system. If you catch it early, cut it out, the likelihood of it ever causing you any problems, as you said, is extraordinarily low.
Yeah, so there are 3 different types of skin cancers, though. Basal cell being the most treatable and recoverable completely, but there are 2 others that aren't so.
Exactly, and to your point, basal cell carcinoma, the most common type of cancer of any type in the United States, just doesn't necessarily get the press. This is a photo of it, kind of a pearly, erosive plaque, like you said, that just doesn't go away, doesn't heal. That's what you want to look for, something that over time is going to start to bleed and break down. The second most common type of skin cancer is a squamous cell carcinoma. It often looks kind of crusty, can grow very rapidly. This one is a keratoacanthoma, which is almost like a volcano-like growth. So if it comes up very quickly and it's crusty and hard, often on the rims of the ears, anywhere on the face or the scalp, that's something you should definitely have checked. That could be a squamous cell carcinoma, because rarely, but as they grow larger, they can actually spread to lymph nodes, so they become a higher risk type of cancer than a basal cell, which almost never metastasizes. And the third most common, or not actually third most common, but the third one that everyone should know about, by far the most lethal, is melanoma. And just by scale, remember, there are only about 90,000 of those diagnosed each year in the United States, compared to, say, 3 to 4 million. But if you catch these late, they can be incredibly dangerous and lethal. And so that's the one we all kind of classically think about. And you can see in the photo something dark, irregular, jagged, certainly arising from a mole. About 50% will arise from a pre-existing mole. 50% will come up as dark, new spots.
So is that one of the reasons also that when we see a mole, people like recommend you to go check this mole out to make sure it's not actually carcinoma?
Absolutely, yes, because with a melanoma, the earlier you catch it, the more treatable it is. So what becomes very dangerous, as you said, is sometimes when you let them go and they become larger, they also become more invasive. And specifically with melanoma, that's when they can go to your lymph nodes or elsewhere in the body and cause incredible damage.
And people should know, it does not matter how dark or how fair your skin is. Melanoma knows no skin color.
Correct. It's actually what killed Bob Marley.
Bob Marley.
So people never think about that darker ethnic skin, that if you have a spot you can't explain, please get it checked out.
And it was on his toe.
On his toe.
And he refused to get his toe removed because he used to play soccer with his kids on the beach every day, and he said, I won't do this to my children.
Yeah.
Wow. No. All right, so I definitely need to ask this. Sort of on that note, on the same note, being, if as children, some of us weren't as vigilant about wearing sunscreen as some other people. I think a lot of people can relate to that. Our previous sort of bouts of sunburn, how does that affect our risk for something like this?
So the sad news is it affects our risk tremendously. So the number of sunburns you get before you're 18 years old is directly proportional to your lifetime risk of skin cancer. In fact, one study suggested that 5 or more blistering sunburns before the age of 20 increases your lifetime risk of melanoma by 80%. So for our generation, where we used baby oil and reflectors and iodine, I mean, that was, nobody knew that this was dangerous. We're certainly seeing the later effects of that. And Ali, to you, because you're so young, we're seeing in younger people, people who use tanning beds are frequently at risk of skin cancer much earlier.
Tanning beds?
I was in Turkey once, Istanbul, Turkey, searching for a tanning bed. There aren't many there because I was so obsessed with being tan and finding tanning beds.
So that's one thing. If you're a parent and you're watching this, just be so mindful about protecting your kids with their sunscreen, with their hats. Even in the winter, remember 80% of UV is reflected off of snow. So just to be mindful year-round, the impact you can make early on is tremendous.
I think we think about it with our children so much, and we don't think about it with ourselves as much.
Well,
I mean, I
too.
slather Alexandra head to toe. She looks like she has just come out. Like, literally, she looks like the Michelin Man, white head to toe. And then me, I think, oh, I'm fine. But
She's got a little on her face. Debbie's out lying in
put it on my
grease.
face, put a hat on.
Well,
I'm
yeah,
done.
the Greeks,
it's not
yes.
great.
No,
So how often should we be getting checked?
Well, I always tell people get a baseline exam. And in general, once a year is a very, very good number. But if you see someone and your dermatologist, like in your case, says, no, you need to be coming in more soon or more frequently, then please follow up with that and do that. And then do remember that with skin cancers, just because you have this one out and the cure rate for you, having had it completely excised, is 95%. The likelihood of this one never coming back is very, very high. But the problem is once you have one non-melanoma skin cancer, the risk of getting another within the next 5 years is 50%.
Like my mom.
So that's why the surveillance is so important. That's why you really do want to keep in that loop. Don't just consider it one and done.
But once again, still not life-threatening, so that's good news.
No, basal cell carcinoma almost completely curable in someone with an immune system that's normal, never spreads to lymph nodes, never elsewhere in your body. Like I said, if you have to have a carcinoma, this is the one to have.
I know you said they're all very different, but if you have one, I'm just curious, I didn't even think of this until now, are you more likely to have one of the other forms?
You're more likely to have something in the non-melanoma skin cancer category if you have one. So for you, it would be basal or squamous.
Okay.
But sadly, there is some data to suggest that you now have an elevated risk of any type of skin cancer because we know you had that exposure, because you're fair, you use the tanning beds. Just so important, if you find something and it's not going away, like you said, after a month, please have it checked. You know, anything that bleeds, that just looks odd, don't feel silly about going in.
Absolutely. Thank you so much
Great
for being here.
information.
It's so important to
much,
hear
Dr.
this
Sonia.
and use it to go in and get checked, everybody. No doubt about
Wear
it.
your
Really appreciate
sunscreen.
this. Wear your sunscreen is a big
Yes, and
takeaway
thank
for
you,
sure.
Ali, for sharing your story and your mom's
Yes.
story, because you're
Thank you,
raising
Ali.
so much awareness this way. So.
Absolutely. All right. For more information, be sure to follow Dr. Batra on her social media, everybody.